they're going to your, your GP, your general practitioner, and saying all these things that they said to me. And I, at that time, would respond and say, well, it's diet and exercise. I mean, I'm thoroughly impressed. I didn't get punched in the throat.
Hey guys, welcome back to the AA Skin Babes pod. I'm your host, Lena, a licensed esthetician. And this week I have Heather.
I'm Heather Taylor, nurse injector.
Anna.
Hi, I'm Anna Van de Velde, an esthetician.
And I have our special guest again, Kim.
Hi, I'm Kim Losik. I am a nurse practitioner, the owner of Horizon Med Spa and Wellness, and the medical director there as well.
And if you want to go more in Kim's backstory, go to the last episode from last week. She went a little bit more in depth there. Last time we talked about medical weight loss, and she also has another aspect to her stuff besides the medical weight loss injections. She does a lot more hormone therapies, and so let's kind of just hit that, like the backstory of that and everything with that.
Sure. So before I had my clinic. I worked in internal medicine, which is another way of saying primary care. I just didn't see kids. So internal medicine is a little bit more about like more complex disease processes. But I would have a lot of patients, particularly women, men as well, but particularly women that would come to me with like, I can't lose weight. I've got this abdominal fat. I can't sleep. I don't have energy. I don't have motivation anymore. I have brain fog, all these sorts of things. And as a classically trained healthcare provider, we aren't really educated on hormones very well. It's very, very surface level, very basic. So when somebody would come to me and they'd be like, can we check my hormones? I'd kind of cringe a little bit inside and be like, sure. And then we'd check their hormones and they'd come back in a normal range. And I would be like, well, they're normal, which I now know that normal and optimal are two very, very different things. So fast forward, in my clinic, I was offering medical weight loss, and I felt like patients were still coming to me with the same complaints. Yes, I can't lose weight, and then I have all these other complaints as well. And I was just kind of really addressing the weight loss factor, and I realized that there's more to this than that there's, patients are like, I'm exercising, I am eating right, I'm doing the same things that I did before, and I could lose 20, 25 pounds, and now I feel like I'm just still gaining, and I don't understand. Their exercise efficiency or their diet efficiency isn't as good. Like, okay, it's got to be bigger than this. And that's when I took a deep dive into hormone replacement therapy and realized that all these women that are talking about these problems
And suffering,
and they're going to your GP, your general practitioner, and saying all these things that they said to me. And I, at that time, would respond and say, well, it's diet and exercise. I mean, I'm thoroughly impressed. I didn't get punched in the throat, right? Because I know there's a lot of people out there who sympathize or like relate to this. Like, okay, well, you just got to eat better and do push-ups and stuff like that. And that's so women's hormone levels decline with age. And it changes so many things drastically. And we have built this culture of just accepting that's, I'm just getting older. I've had kids. It's just part of the things. But the good news is we know now how to solve that and get people feeling their absolute best in their prime of life, which my 40s are the best so far
For sure.
I've ever had.
For sure.
So as much as she does like hormones with everything, but we kind of want to focus this episode on skin health, hormones in your skin. So how with different life stages, we have different hormones. We have puberty, we have pregnancy, we have all menopause, premenopause, all that. Like, how does that influence the skin with the different hormones?
So there are three hormones that we can talk about. You can talk about estrogen, progesterone, and testosterone. And testosterone, there's a large misconception that is only a male hormone. That's absolutely not true.
I say women with PCOS understand this.
Yes. Correct. Yes. So testosterone obviously is much higher in a male, but women still need it to function normally. And those three hormones actually work synergistically to build collagen in the skin, to build elastin in the skin, to maintain hydration in the skin, as well as maintain that we call it a skin barrier, or that lipid bilayer that protects the skin. And those three are all necessary, and all three of those decline with age.
I say, me, I'm younger. I'm youngest at the med spa, I think. I'm in my 20s.
She's a baby.
Mid-20s. And a lot of my clients are in their 20s.
Mm-hmm.
And a lot of girls my age, women my age, have PCOS. And they deal with the high testosterone and stuff. And they've got the rough skin, the facial hair. And so I want to word this in a way that's not... We're told birth control.
Birth control, okay.
Yeah, we're told birth control. But like you working with hormones, is there any hope for us besides birth control for women like me that don't want to be on it?
So, I mean, I will say that my primary focus in my practice are patients who have depleted hormones, not an excess of them. So we'll say that. But
I say this was my biggest question for you. And Mom
Sure.
told me, it was like, we're having Kim on here and we're going to talk about hormones. I was like, can we please hit this? Because I need to know.
So a common complaint is acne, right? Like acne. So testosterone is, and the reason you see this more in patients that have higher levels of testosterone is because testosterone plays a role of increasing the sebum in our skin. So it's the oil producing. Now, if we don't have any testosterone, we end up with very, very dry, fragile skin because we need some oil to maintain hydration in the skin as well as that protective barrier. But then if we have too much testosterone, the byproduct of testosterone is actually called DHT. It's mnemonic for words I can't pronounce. So DHT is a byproduct of testosterone. So testosterone is a hormone. It starts in a cascade and it kind of, you know that game Plinker or something, Plinker or something like that? Plinko, that's it. It falls down and then we're hoping it gets to the jackpot, right? But it might plink over here. So hormones go through a cascade and they kind of convert. So testosterone actually can convert to estrogen, and testosterone also can convert to DHT. And DHT is the only thing that's responsible for acne, increased oily skin, and hair growing in places you don't want, and hair not growing in places that you do want it to. So it's really about controlling the DHT. So I would encourage someone to not only get their testosterone checked, but also have their DHT level checked. And there are certain supplements that you can do and medications that will actually reduce the DHT down so that you're not having so much of that side effect, but able to maintain testosterone, which actually helps with energy.
Yeah, I could talk to her all day about this because I have girls that I'm like, there's natural ways. Like there's supplements. There's got to be something else besides birth control. Yeah. And I will die on that hill.
But that was me. Come at me. Like they just put me on birth control when in my 20s. And then when I turned 35, I hit perimenopause because of it. That's at least what my doctor said. So that was fun.
From the birth control?
Yeah. And now I'm on natural hormone therapy. But it was hard. It was, and I was just being told, oh, it's anxiety. Here's another anxiety drug. Nobody ever...
Well, I feel like hormones are just not talked about enough.
Yeah. No,
right. And
sure.
and this isn't a question you asked, but I think it's a question that's commonly asked is why isn't hormone replacement therapy covered by insurance?
Yes.
So bioidentical hormone replacement therapy means that it's bioidentical. You cannot put a patent on something that it already exists in the environment. So I'll back up and say, so a pharmaceutical company has to get an FDA approval for their drug for insurance to pay for it. Well, if there's something that already exists in the environment, you can't patent it. So the pharmaceutical company is not going to pay for the studies for it. And therefore, it's not ever approved, so to speak. So for example, vitamin D, there's no FDA approval for vitamin D. But we take it to replace our vitamin D, but it's because it already exists in the environment. So what pharmaceutical companies do is they take the molecular structure of like estrogen and they tweak it slightly so that it's not identical, and then they can get an FDA approval for it. The problem with that is if we're tweaking something that's natural and good for us it becomes not good for us.
Yeah.
So the Women's Health Initiative, which came out, I think in 2002, that's the title was that hormones cause cancer are bad for women. Actually, if you look at the details of the study, it has everything to do with the synthetic hormones. It has nothing to do with bioidentical hormones. The studies on those actually show reduction in cancer, improved cardiovascular health, reduction in Alzheimer's disease, and actually reduction in breast cancer.
It's not a one, across the board, like what works for me, works for you, works for you. I mean,
Absolutely.
everybody's different.
Yes, and it's individualized and it's customized for that person's needs, compiling both their side effects or what they're experiencing as well as their labs.
Right.
So next I want to move into the benefits and the risks of hormone replacement therapy. Obviously benefits can be really good, but there are also some risks to it.
Risks, I would say the only risk is that you might experience some mild side effects, to be honest with you.
Mm-hmm.
Now, I wouldn't put a male on testosterone if he had a current prostate cancer, because the prostate actually feeds off of testosterone, but it doesn't mean testosterone's not going to cause prostate cancer, if that makes sense. They're actually using testosterone to treat breast cancer. They actually insert it where the tumor is. There is some research. I'm not saying that's a treatment that's approved. I'm just saying there's some research showing that helps with that.
Interesting.
Honestly, there's the potential benefit. Actually, the almost guaranteed benefit of hormone replacement therapy is huge for a number of areas in our body, as well as disease prevention, as opposed to the downside, which is maybe some side effects, but that can be adjusted.
I think a lot of us don't even notice like we're imbalanced
Yeah.
because it's such a norm now.
Yeah.
It's
Correct.
so
You don't know how
normal to
bad
be
you're
imbalanced.
feeling. Yeah, you don't know how bad you're
You think
feeling
it's
until
just-
you start feeling better.
Yeah.
Well, yeah, I had a patient that I did the questionnaire with her on brain fog, energy, lack of exercise efficiency, night sweats, heart palpitations, all of these things. And she said her answer, she checked yes on all of them. And her response was, well, yeah, but I'm like 45.
Right.
That made me so sad.
Yeah.
I say because I
Like,
was
just, like,
doing
accept it.
something kind of like that, and I was like, "But I'm a mom, so I'm
Right.
awake with my, my brain fog, my tiredness is because I'm a mom," and I'm like, I really think something's out of whack.
And I've always heard it from the older generation, like, oh, that's just perimenopause, or that's just menopause. Welcome to the club.
Right.
So
Right.
You get to
It's-
suffer.
yeah, exactly. Or they just laugh it off.
And the more I think about it, and the more I was kind of going into it, I'm like, I don't think I'm feeling so tired and I'm so brain foggy is because I'm a mom. I think I'm really imbalanced.
Yeah.
Correct. So in regards to skin, I wanted to add this on. If a woman is postmenopausal, so postmenopausal means you no longer are producing estrogen and progesterone. Estrogen plays a role in more than 30% of your collagen production. So for you guys, if you guys do like microneedling,
Yes.
Sculptra, that type of stuff, if you have a postmenopausal woman who is not on estrogen replacement, it's better that you educate her that her results from that collagen producing procedure are going to be minimal and underappreciated, because she has to have estrogen to build the collagen. The estrogen stimulates the fibroblasts, which makes collagen and elastin. So I did this the wrong way. I had a patient that I was doing Morpheus, which is microneedling with radiofrequency, and she was postmenopausal, hadn't been on estrogen, and her results were just underwhelming, and I didn't understand it until I understood that concept. So now it's a discussion that I have with women that if you're going to go and put the money into these procedures, then we should talk about
Overall health.
I say I've
overall
actually had to have
hormone
that
balance.
conversation a couple of times in the last month since I started microneedling.
Older
20
than
years
you.
old. I can't
Yeah.
be like they're older because I'm 20. But I'm just like, I think we have something else off here. We may need to go get hormones looked at, do something, because this is not producing the results it should be.
And I never pressure some people.
Sure.
I never.
But it's
I
just-
educate them.
yeah,
like
right.
I educate. Okay, if you're not on estrogen, you can expect. My
But I always think they have
expectations
a
are
hard
lower.
time with that coming from someone my age. I'm like,
Probably.
I just feel like
Right.
there's something going, there's something off. We might have to look into something else because this isn't working. And I don't think they like hearing that from someone in their 20s.
You can just send them to me.
I know. I'm like,
Exactly.
That's why I told Mom that. I was like, I'm going to send them to you and you talk to them because I think they feel more comfortable with it coming from someone your age compared to my age.
Yep.
That is the one downfall of being 20 years old in this. I'm not 20. I'm 25.
Oh, you poor thing.
The one downfall in this
her heart.
industry is 20-year-old. And she's too young. She don't know what she's talking about.
It's funny.
I did. I had one. She kind of looked at me sideways and she's like, what do you know? You're right.
Heather.
That's what I was like, Mom.
Can I get somebody older in here?
And it doesn't help when I'm like, Mom.
Yeah, that's probably true. Yeah.
Oh, my goodness. Okay, so next question is how lifestyle, diet, and skincare can help support hormonal balance?
There is a lot of research out there, and I've spent a lot of time reading it about because it's a question that people ask me commonly, like, hey, could I boost my hormone levels on my own? Once your body kind of loses the capacity to produce it, there isn't much you can do. Like, I would say different strategies may at most increase your hormone levels by 10%, which is, I mean, it's 10%. It's great. If you want to do things naturally, then stick with that. And I shouldn't say naturally because bioidentical is still natural. If you want to do it without replacement. However, you're not going to get the maximum benefit out of as if you actually replaced the hormone. And there's different ways to do that. You know, you could do it injectable, you could do it by mouth, you could do it a cream, you can do it in a pellet, and we can talk about the different routes probably on another episode.
We'll have to get into that with
other
another episode because that one will be a whole conversation of its own.
Mm-hmm.
Right.
Yeah.
Because I did a little, when I have a guest on, I do a little research in that. And I was like, oh my gosh, there's so much information here.
Mm-hmm.
I don't know what I'm going to do with all this. And then, so we're going to have another episode with that. Common myths about hormone therapy. Once again, I tried to do as much research as I could, but there was a lot being thrown at me with this. And I didn't quite understand it either.
I would say that probably the biggest barrier I run into is estrogen and breast cancer. Mm-hmm. That, like I said, that women's health study or women's health initiative, it was launched in 2002. And it was the headline that got everybody to like, oh my gosh, hormones are bad. If you really look down at the details, the arm of the study, it was actually progesterone, which is a synthetic progesterone, which increased the risk of cardiovascular disease and breast cancer. So I talk about it this way. So we know for a fact that smoking causes lung cancer, right? Everybody can agree.
Mm-hmm.
So it doesn't matter how much we do the study. If we do the study on a different group of people at a different area at a different time, longer, shorter, whatever, we're going to come up with the same result, right? Yep. Because it's true. Estrogen and breast cancer, there's as much, if not more research that estrogen actually prevents or lowers your risk of breast cancer than there is that says it does. So we've done this study thousands of times over and over again, and we cannot come up with a conclusive answer. And in my opinion, that's because it's not true. It's not causing breast cancer. It's just people with estrogen are going to have a greater risk. People,
sure,
they're women.
Yeah,
so
right.
women have breasts and they have
right.
estrogen. So
right.
there's a correlation there, but not a causation. It's not causing breast cancer. I will never step on the toes of an oncologist. If an oncologist says they can't have estrogen, I'm not going to argue with that. Mm-hmm. It's not my role to do that. But I do believe that is a thought process that's incorrect. And there may be some cancers that really can't be around a hormone, so on and so forth. But for the majority of people, hormone replacement therapy is not only safe, it's actually going to increase your health span. Mm-hmm. And one more thing about that. Do you guys know what the number one killer of women is in the U.S.?
Oh my gosh, I just read an article on this.
Heart disease,
yep.
Right? No estrogen. If you have no estrogen, meaning you're postmenopausal and you don't replace it, your risk for cardiovascular disease goes by 30%.
Wow.
The reason we are not we aren't tied to that and we're more tied to the breast cancer is because breast cancer is emotional. If I told you I have breast cancer, how would you respond? I mean, you would be like, oh my gosh.
Yeah.
I'm so sorry. If I told you I had high blood pressure, you'd be like, okay.
Yeah. Mm-hmm. Take a pill.
Are you taking a pill? Right? If you're not, there's no emotional tie to it.
That's right.
Yet the cure rate for breast cancer is more than 90%. So the chance of you getting breast cancer is low, and then the cure rate is really high. But cardiovascular disease is the number one killer, and we increase our risk of that by 30% by not replacing our estrogen, but we're not worried about. Like, it makes no sense to me.
That's so true.
Again, it's education.
Absolutely. Yeah.
Education
I love
is
that.
key.
Absolutely.
For sure.
Which is honestly one of the reasons why we started this.
Right.
Education is key.
Yeah.
And
Because you always say, we don't know what you don't know.
yeah,
No one knows
I don't know what
anything
you don't
unless
know, what we don't know. So you got to let me know what you don't know.
There's a book out there called Estrogen Matters. And to be honest with you, I can't remember the author. Phenomenal book. You can get it on an audiobook, but it's an Estrogen Matters. If you are a female and you have concerns about this, it is completely research-based, and it debunks or at least explains every single thing about estrogen and the opinions of it in regards to disease or not disease. It's a great book.
So go check that out.
Yeah.
Well, yeah. All right. Well, once again, this is the tip of the iceberg here. We are going to have to bring her back on because we have so much more that we need to reach. Like I said, I was trying to research this and like research a little bit into this. And I was just like, oh my gosh, there's a lot of information here. 2, I don't understand a lot of it. 3, it had my brain hurting.
Yeah.
I'm sorry, it did. It had my brain hurting.
It's a lot.
So when I was trying to bring up, like, outline this podcast, I was like, what do I put into this and where do we keep this? Because there's so much here to put this into for our episode. So she's going to have to come back on. Huge thank you to Heather for being here with me today. Anna, what is your Instagram, Anna?
It is Timeless Beauty by Anna.
Awesome. So everyone go follow her. Her Instagram is brand new, so she needs a lot of follows to see what she's doing at the med spa, and we will get into that in another episode. And Miss Kim, where is yours?
Kimberly Losik NP is my Instagram handle. And then my spa is horizon_medspa_wellness.
And if you have any questions, comments about today's episode, or you want to ask him a question, leave it in our comment section. We may touch on it in another episode. So, and Kim also has a PDF. Why don't we tell them about that?
I will also provide a PDF that gives you more information about what you can do to get an appointment with myself or one of our healthcare providers to just sit down and go through. We call it our wellness consult because we address many factors that contribute to how you're feeling, why you're feeling that way, and how we can solve those or how we can make solutions for that.
And if you want one of those and you're interested in that PDF being sent to you, leave us a comment and we will send that to you. So once again, huge thank you for Kim for being here today.
Yeah, thank you.
And we will see you guys next time. Bye.
Bye.